In 1913, the Bureau of Labor Statistics documented approximately 23,000 industrial deaths among U.S. workers with a workforce of 38 million people. In 1997, the number of work-related deaths dropped to 5,100 with a workforce of over 130 million people. That means that over the course of 84 years, the rate of workplace deaths declined from 61 deaths per 100,000 workers to 4 deaths per 100,000 workers. That's why the improvement in workplace safety has been defined as one of the greatest public health achievements of the 20th century. These significant improvements in workplace safety didn't occur by accident. They were the result of major efforts at the federal and state levels. One of those efforts at the national level was the Occupational Safety and Health Act of 1970. In Minnesota, many of the workplace safety efforts have been implemented through the Minnesota Department of Labor and Industry. On today's episode of A Public Health Journal, we're going to look at how the work of that department is helping to protect the health of Minnesota's workers. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ehlinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at workplace health and safety in Minnesota and how the state's Department of Labor and Industry is working to protect the health and safety of Minnesota workers. We'll look at the significant successes that have occurred and what still needs to be done to protect workers. Joining me in this discussion is Ken Peterson, Commissioner of the Department of Labor and Industry. Commissioner Peterson has served in this position in the administration of Governor Perpich in the 1980s and for the past 6 years under Governor Dayton. Ken, welcome to the program.
Thanks, Ed. Good to be here.
And I think you have probably the best acronym of all of the agencies, DOLI, the Department of Labor and Industry.
It's a great acronym.
Yes.
We love it.
So when we talk about DOLI, for the folks here, that we'll be talking about the Department of Labor and Industry. So what is the role of the Department of Labor and Industry in Minnesota?
We've got several roles in terms of safety. The most significant one that people talk about a lot is just we administer the workers' compensation system. And that is, if you're hurt, you come in, or you submit a first report of injury and you go through the process of being reimbursed for your medical costs, and they need time off. And so we administer that system. Another significant thing we do is also run the Minnesota OSHA. Minnesota has what's called a state plan state. We're a state plan, so we operate our own OSHA program. We've got about 80 people in our OSHA office that do inspections, do examination of the workplace, but also provide safety advice. So those are 2 areas we actually work in safety, and I think we're doing a good job.
Okay, so at the end of the program, we'll talk about workers' comp, because that's a huge issue, and OSHA, there's that federal law, and then we do it at the state law. But before we get into those and some of the specific programs, I mentioned at the beginning of the program that we've had some tremendous successes. And I've got a slide here that just shows since 1980 the kinds of deaths that have decreased, and this doesn't even highlight the fact that we had 71 deaths per 100,000 workers in the early 1900s down to now 4 deaths per 100,000. And just shows that, all kinds of workers or deaths are decreasing dramatically, even in the last 20 years. Why did that happen? What was behind this huge reduction in deaths?
Well, you're right. There's been a lot less hurt. There's a lot less economic hurt, family hurt, emotional hurt, community hurt, because of fewer accidents, fewer deaths. I think it's been a combination of circumstances, a combination of things. One, government regulation, tougher inspections, that's made a big difference. I think that a greater awareness on the part of both employers and employees about the need for safety. I travel around the state a lot, and I talk to a lot of businesses. And I compare that with when I was commissioner 25 years ago, and there's no comparison. People are just much more concerned about safety. Maybe because we don't have enough workers, I'm not sure, but people are more concerned about safety. It's driven into people's minds. So I think it's a great awareness. Technology has changed too. One area particularly that's always impresses me is logging. When I was commissioner before, logging was the most unsafe business in the state. Now, because of technology, there's very few actual accidents in logging. Meatpacking is another area where great strides have been made in protecting people. So technology has helped a lot, and also I think a greater awareness.
Mm-hmm. Well, I know at the early part of the 20th century, mining was also a huge issue, and it was really, a problem. And there's less mining, but even in mining now, the death rates have dropped dramatically. It's safety. So what do people do, to make it safer?
One thing we've done in Minnesota is the core of our whole safety program. That we talk about safety. We have what's called the AWARE Act. That means under the AWARE Act, an employer and the employees every year examine their work site. They walk around, look for possible problems, look for potential hazards, and then try to solve them, work together. So we think that the biggest single thing you can do for a safe work site is not government intervention, it's not technology, it's the employers working with the employees to make it a safe place, have a cooperation. Many companies have safety committees, they work together. I know in state government we do, and that's been very successful. So I think it's that working together to stop those hazards. But after that, there's a number of other steps we can take as well.
Has organized labor, like labor unions, has that also been a push?
Organized labor has been just really key. OSHA, the federal OSHA Act would never have passed without organized labor. They pushed it and pushed it and pushed it, and so it was passed in the early 1970s, as you pointed out there. And they've been very insistent over the years, trying to maintain that we have strong labor regulations. When we do an inspection, when OSHA does an inspection, comes on a site, we ask whether it's an organized plan. If it is, there's always a member of the union walks around, a representative of the union walks around with us to ensure that we've seen everything and that all the problems are noted, and that they become a party in any penalties we issue.
And what kind of regulation comes from the federal government or from state in terms of the things that businesses have to pay attention to?
There's a combination of standards. They put out, the federal government puts out a lot of standards, and what we have to do in the state level is do as well as they do. Then we also have some of our own standards. Some of the ones that we're particularly proud of. We're the first ones in the country to have a right to know law. That is a right to know about hazardous substances in your workplace. That's been very important. We passed that 10 years before the federal government did anything.
So that'd be like chemicals in the workplace.
Cleaning materials, anything else that could potentially cause problems that you have a right to know about. Every worker has a right to know about that. Other things we do in Minnesota, we have a couple years ago, we led the country in deaths from window washing. People were working on windows, falling off and being killed. We had 3 in over a 2-year period. So we've set up our own window washing standards that are tougher than the national average to make sure we have no more of them, and we haven't. And some of the companies tell me they're very grateful we did it. So we have the areas, we look at areas that may have been particularly concerned in Minnesota, or just that seem to be causing problems, and issue our own rules and regulations.
So how do you measure what you do, or how do you find out? I assume there's data reporting, and then there's research that's being done on what's causing things, and then you kind of
we're data driven, completely data driven. We determine what inspections we do based on the workers' comp injuries they have. So we look at if an industry is dropped considerably, like logging, their injuries have dropped, so we don't do as many inspections of the logging industry as we would. But construction, particularly in the roofing industry and trenching, they always have very high rates of injuries, and so we spend more time looking at them. So we look at where the workers' comp injuries are occurring, where the more serious ones are occurring, and then go out there and look at them. So data is very important to what we're doing.
Right. And this is an agricultural state. What's your role in agriculture?
Agriculture is an interesting area. Since the OSHA law passed in the early 1970s, OSHA agencies have been forbidden from going on to farms with or agricultural facilities with less than 10 employees. So that means most farms in the state are not looked at for OSHA. We certainly look at bigger ones, bigger farms, bigger facilities, and inspect those and look at them. But we do, every year we have a few problems with grain elevators, rollover tractors, that sort of thing, that OSHA really can't do much about.
Okay. Well, as we look into the future, this is one of the areas I know, because as I hear about injuries that occur a lot on family farms and some of the deaths. All right, well, I want to talk about some of the specific issues that you deal with and some of the specific people who are most injured. But first, we need to take a little break. We'll be back right after this message.
would you bring to my company?
What do you need?
I need problem-solving skills.
I got through high school without a car, a phone, or a computer.
No college degree, though.
Not yet, but life's taught me a lot, and I'm ready for more.
Well, you're not the typical kind of candidate that I hire. But you are exactly what I'm looking for.
Your company could be missing out on the candidates it needs most. Learn how to find a great pool of untapped talent at gradsoflife.org.
Welcome back. We're talking about occupational health and safety with the Commissioner of the Department of Labor and Industry, Ken Peterson. Ken, you talked about, we've really improved a lot on what's going on, but there's still people who are getting injured and dying, unfortunately. And I've got a little chart here that shows the characteristics of the people who have been injured, the workplace characteristics. And I want you to kind of explain, because this I thought was remarkable to me in terms of who got injured. So let's talk a little bit about what's going on in this little chart.
First, you can see 63% were men. And that's men historically have been working in some of the more dangerous occupations, such as more men in construction, more men in manufacturing, maybe a lower percentage of them work in offices, which are traditionally more safe. The second one is the 24% were over 54 years old. That's an interesting figure. That's higher than that percentage of people in the workforce, but I think that a lot of those people, their body's getting older, they're more susceptible to back injuries, to maybe other things. Their reflexes probably aren't as quick, and so they may have more injuries than others. Then the bottom two to me are very interesting. 10% are to injuries of people under 24 years old. So those are relatively new people in the workforce, and that's maybe roughly the percentage of those people in the workforce. However, when it says that 31% were injuries to people in their first year, within the first year on the job, this is the one that's hardest for us to handle. Every year we seem to have one death or a few serious injuries to somebody who just in the first week of work went out on a job, wasn't properly trained, and something terrible happened to him or her. And they're all very sad. That's why we like apprenticeship programs, training programs that emphasize safety. We require every apprenticeship program in our state to have every apprentice to go through at least 50 hours of safety training before she or he becomes a journey person. So they know what they're doing. But also they watch others on the job, seeing how they treat it. And so that experience on the job is really important. You don't have experienced workers getting hurt as much as you do inexperienced workers.
Sort of like the graduated driver's license. When you first start driving, you're at higher risk, and the more you drive, the safer you get.
Very good point.
But our economy is changing so that we have what we call gig workers. You do one job for a little while, and then you do another job. When you and I started, and it's because we're sort of old timers. People sometimes work for an agency or organization for 30, 40, even more years. But now people work for shorter periods of time and go to another occupation. How does that play into this?
We think there are a couple issues here when you're talking about, and it probably all needs more research. Mm-hmm. I'll just lay that out first. But from what we know now is that the more often you switch jobs, the less familiarity you have with the position, the less time you've watched other people do it, higher the incidence of accidents. No question about it. Just the shorter you've worked on it. Then, in terms of the gig economy, people, and it's an interesting term, and it seems to include, there's different percentages attributed to how big the gig economy is. Generally short-term workers. Some work for a third party, like a staffing agency. Others just work for a short time. Maybe sometimes you're just a consultant, you go online. So they're all considered. And the numbers vary from somewhere to 3% to 30%, but I think the best number is that about 15 to 16% of those people of the workforce is in the gig economy now. And of those people, particularly the ones that have lower paid jobs, that work for staffing agencies, and that have temporary jobs, both their incidence of accidents is much higher. And we're also seeing, this is a very troubling one too, we're also seeing much more mental health stress on the job. And part of it is because you don't know where your next paycheck's coming from, or you're unsure about the job, or you don't even know what you're doing on the job. And so there's just a certain psychological stress that's going on with those individuals all the time. And I don't think most of our laws are set up for a mid-20th century economy. That's not the economy of the future. We're going to see more of these short-term workers for a variety of reasons, some good and some bad.
So you pay attention to mental health in addition to the physical health?
Yes, we're very concerned with mental health. In Minnesota, we do have post-traumatic stress disorder for PTSD, for workers' comp, but it's strict. It's not everybody can get it, but it's mostly aimed at people who are observe some something that's shocking that happens, some terrible disturbance. But we are very concerned, and part of and you know this better than most people, Ed. The part of the problem is if you're undergoing mental health stress, you're probably not going to be as good in the job. You're going to be more likely to be in an accident. You're going to be more likely to cause issues with other people. So we think mental health is very important. So
when you talk about employers paying attention to workplace safety, are they also paying attention to the emotional health of the workers? It's
going to vary from employer to employer. Some do and some don't. And our concern is with these short-term workers, there's very little concern with them because they're transferable. I mean, they're interchangeable. They're generally lower wage people. Oftentimes they're minorities, but not all the time, but they're interchangeable. So their skills are interchangeable. And so they're not there as long, and so the employer probably does, even the best intended employer, is not going to be able to spend the kind of time to look in their mental health and to translate that into better performance on the job and safer performance on the job.
All right. I want to talk about workers' comp, and we're going to take a break here soon, but I want to get this just one little chart in first before we go to a break. It sort of talks about what parts of the body that are injured. And again, it just so that the audience can understand where injuries, physical injuries occur. And I think it's remarkable to tell us where you see this in this chart.
Yeah, the highest percentage you'll see there's arms to hands, 23%. I think that's pretty reasonable to expect. You're working with machines, something happens, something bad happens. Those aren't the most serious, although just yesterday we had an arm amputation that occurred up in a factory up north. But backs are the second one, and they often occur more to older people, but not always. And just the constant strain on someone's bending back and forth, and so they're going to have problems. Burns are a relatively small percentage you can see on there. I guess we don't even have burns on there. Well, burns are a relatively small percentage, but they are also very, very serious ones. The shoulders, you can see lifting, that sort of thing. And so I think you can sort of get a
sense of what really the stresses are in the work.
Just you think about any place you work, or you've done work, just the physical work you do on the house. Those are the type of things you're going to hurt in the job.
Good. All right, well, we're going to take a little break and we'll come back to talk about workers' comps. So we'll be back right after this message.
I've got a job to do today.
I've got a job to do today.
First day at work, Mom.
Your donations to Goodwill fund job training programs right in your community.
Feels good to start fresh, right?
Sure does.
And like that, you're a job creator.
Welcome back. We're talking with the Commissioner of DALI, the Department of Labor and Industry, Ken Peterson. Ken, workers' comp, you said, is a huge part of what you do. So explain workers' comp. What is it?
Workers' comp came about the beginning of the last century, the 19th century, in the early 1900s. And what it basically is an agreement between management and labor. That labor gives up its right to sue an employer if someone's hurt in district court. And in return, on a job injury, it's guaranteed medical care and guaranteed what they call indemnity benefits, wage replacement, while you're out of work. And so it's just a basic agreement that goes on between management and labor, and now it's become it's not a written agreement, but it's there, and it's one that has to be respected. So the workers have given up a great deal by forfeiting the right to sue, but at the same time, they get a guaranteed if they're really hurt on the job, they'll get guaranteed care and they'll get wage replacement.
Now, is this a federal or
No,
state?
It's a state. It's a state. Every state does their own. Minnesota has, I think it's a reasonably good system now. We've had problems over the years, but it's a pretty good system. It's worked pretty well for people. I think that our benefits for injured workers are among the top 10 or 12 in the country. But Minnesota's a high wage state too. It's a higher, it's a higher cost state to live in too. But we do have our benefits are good. The medical care is always good. One of our problems is increasing, as throughout society, increasing costs of medical care. That trying to keep rates down. But overall, our system works pretty well. That this medical cost has become one of our real problems, though. That when I was commissioned before, 40% of our costs were medical costs. Now, somewhere around 60% are. And so we're trying to, as elsewhere in society, we're just trying to level those off, trying to bring them down. And we've had some successes, but and so it's working well. But for the employer, workers' comp has become it's nowhere near the controversy it once was. The costs have gone down something like 20% over the last 15 years.
Right. I think actually we have a slide that shows what goes on with the cost with workers' comp, and maybe you can explain.
Yeah, it's pretty substantial. The paid claims, you can see the paid claims for 100 full-time employees have dropped down from basically cut in half what they were. So that's a pretty big change. That's been very important in society. So that means the premium rates that you're paying as an employer have dropped considerably. And just this year alone, we've recommended to the companies, insurance companies, that their so-called pure premium rate, what they need to pay to take care of their injured workers, should be dropped by 12%. So that means for every employer in the state, public, private, nonprofit, whatever it is, they should be saving somewhere between 10 and 12% on their workers' comp insurance.
Okay.
So that's good news.
So the costs have gone down. Not because medical costs have gone down, but people have needed less of it. It's probably because of the prevention.
It's much safer. Yeah, one figure I love to use is when I had this job before, we had 156,000 people hurt in the state in 1990. 156,000. We had a workforce. This is a lot of numbers, but 156,000 people hurt in the state, and we had a workforce of 2.2 million. Last year, we had something like 96,000 people hurt in the state, and we had a 700,000 person larger workforce. So that meant that just the numbers were incredible. That if we had kept up the old rate, you would have had 29,000 more people hurt. But instead, we had 60,000 fewer people hurt. So as you were saying earlier, it's one of the great public health stories of this century, of our time, that we decrease the amount of hurt that people have.
So how does workers' comp fit with medical insurance? Most people have health in our state. 96% of people have health insurance. How does this?
In Minnesota, you're required to have workers' comp insurance. That every employer is required to have work comp insurance on his or her employees. Then, if you are hurt in the job, the workers' comp insurance pays for the work injury, not your health insurance, not your regular health insurance. And so that's something that doctors always have to work out. They'll ask you, is this a work comp injury or is this a regular injury? And so they'll look at it. And it's sold by workers' comp insurance. It's sold by a number of companies. I think we have something like 300 insurance companies that are authorized to do business in the state of Minnesota. It's a very competitive field. If you're a business person, shop around, you'll get a good rate.
All right. So are all employees covered by workers' comp, whether you're part-time or full-time?
Yep. Now,
big business, small
big
business?
Business, small business, they're supposed to be. Sometimes we have employers who are not. And in those cases, then we have what's called a special compensation fund that covers them, and then we try to go after the employer. But sometimes we do have employers who just didn't have it,
right,
for one reason or another.
So in the last minute that we have, what do you see as the challenges ahead? We made huge progress, still a lot of people getting injured. What do you see as the challenges for the next 10, 15 years? One
we talked about already is the gig economy. Another one is sick leave. People that don't have sick leave have a lot more injuries. And so I'm not sure which direction we go. We know the Twin Cities, each of the Twin Cities have adopted something. We may have to adopt something on a state level. We may have some guidelines. I'm not sure how it works, but we're going to have to do something about that. That's an area where we're going to have to, in order to keep injuries down, I think we're going to need something on sick leave.
I know we've been working on sick leave because it really has
Yep.
a lot related to health, not just to injuries, but also infectious disease and
No
mental
question.
illness. And so, well, Ken, this has been really helpful. Thank you. A great, most people don't understand that Dolly is a public health agency, and you certainly have.
And we certainly feel that way about it.
Good. All right.
Thank you very much,
Thank you for partnering with us. All right. And I'll be back with a closing comment right after this message.
Of all the things you've done with your bike, donating it to Goodwill may be the most incredible of all. Your donations help fund job placement and training for people in your community, which means your stuff can be more powerful than you think. Goodwill. Donate stuff, create jobs.
Most people spend a significant part of their lives at work. Other than one's home and community, the work site is probably the place where people spend the preponderance of their time. And we know that the environment where you live and work has a huge impact on your health. In fact, those environments have a greater impact on your health than medical care. That's why it's so important to create healthy homes, healthy communities, and healthy work sites. And just like there are multiple factors that make a home and a community healthy, there are multiple factors contributing to a healthy workplace. Certainly there needs to be a healthy physical environment with clean air and water and sanitation. And protecting from injury and various toxins is also crucial, as is access to healthy food. But there also needs to be a healthy emotional environment in the workplace. A workplace where people are valued and treated with respect, because a hostile workplace is stressful and a major contributor to poor health. Part of creating a healthy emotional environment includes rational work hours, paying a living wage, having pay equity among various groups, and having access to benefits like paid time off for illness, childbirth, and other family situations, and having some autonomy in one's work. It also includes being inclusive and supportive with employees from diverse backgrounds. Creating healthy conditions in the workplace is a responsibility that extends beyond just the owners or managers. It is a responsibility of all of us. That's why labor and management working together with some governmental oversight has been so successful over the last century in creating healthier work sites. It demonstrates the truth of the definition of public health as what we do collectively to assure the conditions in which people can be healthy. Collectively, we must strive to create healthy work sites because we know that they benefit not only workers, but employers, stockholders, families, and communities. As Paul Wellstone once said, we all do better when we all do better. That certainly is true in our daily work. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.